Today we will discuss our next topic in esophagus, that is esophagitis. Esophagitis refers to inflammation of the esophagus, yani esophagus ki inflammation. The esophagus is lined by stratified squamous epithelium. This epithelium protects against mechanical trauma during swallowing. Despite this protection, the mucosa can still get injured due to multiple causes. These include physical trauma, chemical injury, infections, medications, and immune-mediated disorders. Patients usually present with dysphagia, yani swallowing में difficulty. They may also have pain on swallowing, chest discomfort, or sometimes bleeding. Esophagitis can be classified based on its cause. यानी हम esophagitis को इस बात की बुनियाद पर डिवाइड करते हैं कि इन्फ्लेमेशन किस वजह से डेवलप हुई. Major types include esophageal lacerations, chemical esophagitis, pill-induced esophagitis, and iatrogenic esophagitis. इसके अलावा infectious esophagitis और eosinophilic esophagitis भी important categories हैं. हर टाइप का mechanism different होता है. किसी में डायरेक्ट इंजरी होती है, किसी में इन्फेक्शन रिस्पॉन्सिबल होता है, और कुछ केसेस में इम्यून सिस्टम खुद इन्फ्लेमेशन प्रोड्यूस करता है. One important category of esophageal injury is esophageal laceration, यानी esophagus की वॉल में tear. ये इंजरीज ज़्यादातर फोर्सफुल वॉमिटिंग या रेचिंग के बाद डेवलप होती हैं. रेचिंग से मुराद रिपीटेड वॉमिटिंग की कोशिश है, चाहे वॉमिट निकले या ना निकले. जब प्रेशर बहुत ज़्यादा इंक्रीज हो जाता है तो एसोफेजियल वॉल में इंजरी हो है. बेस्ड ऑन द डेप्थ ऑफ इंजरी, esophageal lacerations are divided into two major types, Mallory-Weiss syndrome and Boerhaave syndrome. Mallory-Weiss syndrome में इंजरी सिर्फ मुकोसा तक लिमिटेड होती है, जबकि बोरहावे सिंड्रोम में पूरी एसोफेजियल वॉल रप्चर हो जाती है. इसी वजह से बोरहावे सिंड्रोम काफ़ी ज़्यादा डेंजरस कंडीशन. Mallory-Weiss syndrome involves mucosal tears, यानी esophagus की inner lining का tear. These tears are usually longitudinal. They occur after repeated or forceful vomiting, most commonly near the gastroesophageal junction. Increased pressure causes mucosal rupture. The most common presentation is hematemesis, यानी vomit में blood आना. This occurs due to mucosal vessel injury. The tear is usually superficial, so most cases heal spontaneously. Boerhaave syndrome is a full thickness rupture of the esophagus, यानी esophagus की पूरी वॉल टेयर हो जाती है. This is a medical emergency. Food and gastric contents leak into the mediastinum. This leads to mediastinitis, sepsis, and shock. Chemical esophagitis occurs due to direct mucosal injury caused by corrosive substances. These include alcohol, acids, alkalis, and very hot liquids. Heavy smoking may also contribute. Damage can range from mild inflammation to deep ulceration. Pill-induced esophagitis occurs when a tablet gets stuck in the esophagus. यानी pill stomach तक नहीं जा पाती. It dissolves locally and injures the mucosa. Common drugs include doxycycline, bisphosphonates, NSAIDs, and potassium chloride. The most common symptom is odynophagia, यानी swallowing के वक्त pain. Dysphagia may also occur. Severe cases may lead to ulceration, bleeding, stricture formation, or perforation. Iatrogenic esophagitis is caused by medical treatment. Chemotherapy damages rapidly dividing epithelial cells. Radiation therapy causes both direct and vascular injury. Graft versus host disease may also involve the esophagus. Infectious esophagitis occurs mainly in immunocompromised patients. Normal immunity usually prevents these infections, but when immunity is weak, opportunistic infections develop. Common organisms include Candida, HSV, and CMV. Candida is the most common fungal cause. It produces white or gray-white pseudomembranes. These consist of fungal organisms and necrotic debris. HSV infects squamous epithelial cells. It causes small punched-out ulcers, yani deep small ulcers. Histology shows multinucleated giant cells and viral inclusions. CMV causes broader and shallower ulcers. It mainly infects endothelial and stromal cells. Histology shows nuclear and cytoplasmic inclusions.